How to avoid and treat altitude sickness. Treating altitude sickness. If you have symptoms of mild altitude sickness, you shouldn't go any higher for at least 24 to 48 hours. Most cases will improve during this time, but it may help if you don't exercise or drink plenty of fluid, but not alcohol. Don't smoke, rest until you feel better. Make sure you tell the people you're traveling with how you feel, even if your symptoms are mild. This will help them be more aware of signs of severe sickness, such as irrational behavior, if you develop them. Descending to a lower altitude. If you have mild symptoms of altitude sickness that don't disappear over the course of 24 to 48 hours, the best thing to do is descend by at least 500 meters, about 1,600 feet. Don't attempt to climb again until your symptoms have completely disappeared. After 2 to 3 days, your body will have acclimatized and your symptoms should disappear. If you have severe symptoms or your symptoms are getting worse, descend immediately by as much height as possible. This is because severe altitude sickness can be fatal if not treated quickly. Seek immediate medical help when you reach a low altitude. Oxygen treatment. Increasing your oxygen intake with bottled oxygen or portable hyperbaric chambers, also known as Gamma or Certec bags, can help to temporarily improve some of the symptoms of altitude sickness. A portable hyperbaric chamber is a bag you're zipped into, which is then pumped full of air. After 1 to 2 hours of treatment, your symptoms should improve significantly. The effect of the treatment is equivalent to descending about 2,000 meters, 6,500 feet. However, while oxygen treatment or the use of a hyperbaric chamber can relieve the symptoms of altitude sickness, it's not a replacement for descending to a lower altitude. You should always descend if you have severe or worsening symptoms, even if you've had oxygen treatment. Medication. Painkillers. Painkillers, such as paracetamol or ibuprofen, can be used to treat mild headaches caused by altitude sickness. Anti-sickness medication. If you're experiencing nausea or vomiting, a type of medication called an antiemetic may be useful. Promethazine is an antiemetic medicine often used by people with altitude sickness. Research has shown that can reduce the severity of altitude sickness symptoms and can help prevent the condition. Altitude sickness can change the chemical balance of your blood. It's thought that acetazolamide helps correct this chemical imbalance. In the UK, acetazolamide isn't licensed for treating or preventing altitude sickness. However, it may sometimes be considered for use off-label to help prevent altitude sickness in people with a history of the condition. Read more about unlicensed medicines. There are a number of common but minor side effects associated with acetazolamide, including numbness or tingling of the face, fingers or toes. Some people find these quite distressing, so doctors often suggest trying it at home for 2 days before traveling if you're likely to use it at altitude. You should let your doctor know if you have an allergy to any medicines before acetazolamide is prescribed. Your doctor will also check your medical history to see if acetazolamide is suitable for you. Nifedipine. Nifedipine is often used to treat high blood pressure, hypertension, but it can also be useful in treating high-altitude pulmonary edema. See complications of altitude sickness for more information. This medication decreases the narrowing of the artery that supplies blood to the lungs, helping to reduce chest tightness and ease breathing. It's usually taken as a tablet at 6 to 8 hour intervals. Nifedipine can cause a sudden drop in blood pressure, so it's important not to get up too quickly from a lying or sitting position if you take it. As anyone who has ventured thousands of feet above sea level can attest, altitude sickness can be a real and uncomfortable condition. It packs such a punch, in fact, that most people who vacation in the high country are assaulted with tips to avoid altitude sickness. Trust me. Even though I live in Colorado year-round and my body is relatively acclimated, I always experience a change when we go to the mountains. I follow my own tips to ease my body through the physical shock of oxygen deprivation, aridity, and a powerful sun. The higher you go, the thinner the air. Get too high too fast, and your body doesn't get the oxygen it needs. Most people can reach 8,000 feet without experience altitude sickness. But the ailment can strike as low as 5,000 feet above sea level. Common altitude sickness symptoms can strike anyone, regardless of their fitness level. They include headaches, dizziness, loss of appetite, nausea, vomiting, fatigue, loss of energy, insomnia. Without further ado, I present my perennial tips to avoid altitude sickness in the mountains. Hydrate. This is the best way to help your body adjust to high altitude. Generally, the low humidity at altitude keeps the air dry, so you should drink twice as much water as you would at home. Also keep in mind that you want to add water to your body, not deplete it. At least initially, avoid caffeine and alcohol. Replenish. Foods rich in potassium are great for acclimating. Some good staples to eat include broccoli, bananas, avocado, cantaloupe, celery, greens, bran, chocolate, granola, dates, dried fruit, potatoes and tomatoes. Do your body a favor and decrease salt intake. Additionally, complex carbohydrates are great for stabilizing your blood sugar and maintaining energy. Eat plenty of whole grains, pasta, fruits, and vegetables. Easy does it. You've been planning an epic winter vacation for months. But this is the first time you've logged any time above 6,000 feet. You will feel the effects of exercise more at altitude than at home. By all means, get after it. But dial back the effort if you're short of breath, sore, or consistently fatigued. Shade yourself. The big sky country of the mountains isn't a figment of your imagination. There's less water vapor in the air here, which makes the color of the sky bluer than the sky at home. That's pretty. It also means there's 25% less protection from the sun. If you don't lather up with sunscreen, a proper amount to apply is a shot glass worth each time you burn. This is true regardless of your complexion. Doctor's orders. If you're concerned about altitude sickness, visit your doctor before your trip. She can go over common symptoms and may even recommend acetazolamide, also known as Diamix, the most common drug for altitude sickness prevention and treatment. Non-prescriptive antidotes for altitude sickness symptoms include ibuprofen to relieve altitude-induced headaches, and ginger chews, capsules or tea to settle the stomach. Acclimate. This isn't just a technical term mountain climbers throw around to sound cool. Adjusting to higher altitude can take a few days. If you have the time, consider spending a night or two at an intermediate altitude, say, spend a night or two in Denver before heading up to Vail. If that's not an option, plan calmer activities the first 24-48 hours of your trip. Prepare. The days might be warm. But when that big ball of fire goes down in the sky, mountain nights are cold. Prepare your body for this Jekyll Hyde temperature swing by bringing extra layers out in the evenings. Seek help. Whether your symptoms are consistently mildly uncomfortable or they're acute, altitude sickness is real and can be debilitating. If attempts to alleviate them don't work, head to the nearest medical clinic. They are staffed by knowledgeable medical professionals who understand the impacts of altitude on the body and will help.